All right, today we are diving into a condition where the clock is always ticking. Meningitis. We're talking about a sudden, severe inflammation of the very shield that protects our body's command center, the brain and spinal cord.
And this right here perfectly captures the dilemma. Imagine you're an ER doctor. These symptoms walk through the door and you have to ask a critical question. Is this just a common virus, or am I looking at a neurological emergency about to unfold right in front of me? The answer can change a life in a matter of hours.
So yeah, we're not just talking about a simple infection here. This is an all-out assault on the central nervous system. And to really get a grip on the urgency, we first have to understand what happens when the brain's critical defenses are breached.
So what are the meninges exactly? Well, think of them like a three-layered shield wrapping around your brain and spinal cord. When pathogens get in, the shield gets inflamed, it gets swollen, and that creates this high-pressure crisis inside your skull, which has absolutely zero room to expand.
You see, meningitis on its own is kind of a general term. The real danger, well, that all depends on what is causing the inflammation. So the first step in this whole battle is figuring out who the attacker is, because let me tell you, not all culprits are created equal.
And this is where it gets really important. Viral meningitis is way more common, and thank goodness it's usually less severe. But bacterial meningitis, that's the one we're really focused on. Even though it's rare, it's the one that is a true neurological emergency. It is aggressive, it's incredibly fast-moving, and it can be fatal.
The attack basically unfolds in three devastating stages. First, the invaders, these pathogens, they breach the blood-brain barrier, which is supposed to be this super selective border protecting the brain. Once they're inside, the body's immune system launches this massive counterattack. But here's the crazy part. That fierce response is the problem. It causes severe inflammation and swelling in an area with no give, leading to a dangerous spike in pressure that can literally crush brain tissue and cause permanent damage.
Okay, so with the brain literally under siege, the body starts screaming for help. It sends out these critical alarm bells. And recognizing these signals as early as humanly possible is just absolutely vital. In the ER, doctors are looking for what's called the classic triad. It's this combination of symptoms that just sets off all the alarms. You've got fever, which signals infection. You've got neck stiffness, which points to irritated meninges. And then any change in mental state, like confusion or being extra drowsy, that means the brain itself is being affected. When you see these three together, that's a massive red flag.
But there is one sign that's even more specific and frankly terrifying. A petechial rash. We're talking about tiny, purple-red spots that don't fade when you press a glass against them. This is a hallmark sign of meningococcal meningitis, one of the most dangerous bacterial forms. It means the infection is in the bloodstream, and it is a sign of a true medical crisis.
All right, so the alarm bells are ringing, suspicion is sky high, but you can't just go on suspicion. Doctors need proof. They need a way to look directly at what's happening inside the central nervous system to confirm what's going on and identify the enemy.
So, you might be wondering, how do they get that certainty? Well, they need to actually sample the fluid that's bathing the brain and spinal cord. And they do that with a procedure called a lumbar puncture, which you might know as a spinal tap.
That fluid, the cerebrospinal fluid or CSF, it tells a story. With bacterial meningitis, the fluid is cloudy. It's full of infection-fighting cells. Protein levels are sky high. But the real smoking gun? The glucose level. It plummets. Why? Because the bacteria are literally gobbling up all the sugar in the fluid to survive. Viral meningitis, on the other hand, leaves a completely different signature. But hold on. There is a super important safety check you have to do before that lumbar puncture. If there are any signs of massively increased pressure in the brain, like a swollen optic nerve or weakness on one side of the body, you have to get a CT scan first. Doing a spinal tap in those cases could be catastrophic. I mean, literally. So this step is absolutely non-negotiable.
So now you've got a strong suspicion, especially for bacterial meningitis, and the race is on. There is absolutely no time to waste. Every single minute of delay can lead to more brain damage.
And this right here might be the single most important principle in managing meningitis. You do not wait for lab results. The risk of waiting is just far too high. Treatment starts based on clinical suspicion, and it starts right now. So what do? They hit it hard and fast with a powerful cocktail of high-dose IV antibiotics, ones chosen to cover the most likely bad guys. At the same time, they'll often give a steroid. Now, its job isn't to fight the infection itself, but to calm down that dangerous information that causes so much of the damage.
So let's just hammer this home. This is the guiding principle, the absolute rule of thumb. If you suspect bacterial meningitis, you treat it, period. The classic signs are enough to get the ball rolling. The lab results will eventually tell you for sure, but the fight has to begin long before that proof arrives.
So in this race against time, what is our most powerful tool? It's not just the powerful antibiotics or the fancy diagnostic tests. It's awareness. It's the ability to recognize those warning signs and to understand the absolute urgency of the situation. Because in this fight, the only thing more powerful than the medicine is a head start.